Okay, so I'm just going to verify that my patient's COPD is getting a central line dressing change. It does say this right here. She has no known allergies to chlorhexidine or tape. And it says that I'm going to need a normal saline and a heparin flush. So I'm going to do my first med check with my normal saline. So my patient is COPD, no known allergies. I need a 10 ml normal saline flush given IV. I have that here. It's not expired and the bottle is intact. And then this is just going to flush the line before I get the heparin. And then this, I need only 1 ml, so I'm just going to go waste part of this over in the sink because there's 10 mls in here. So I'm going to go over to the sink. And I'm going to waste it all the way up to 1 ml. And I'll make sure to get all the bubbles out so it's primed as well. Okay. Recap it and go back over to my MAR. Okay. So my patient is COPD, no known allergies. I'm giving heparin, flush, 1 ml IV, and I have it in here. The expiration date is good. The tubing is intact, and I need 1 ml, and I have 1 ml here. And this is just for heparin lock to make sure that no clotting happens within the lumen and to prevent anything from sticking in there. Okay, so I did all my med checks, verified my order. Now I'm gonna go to my patient's room.
Hi.
Hi, C. It's Amelia. I'm gonna be your nurse today, and we're just gonna be doing a dressing change on your central line. Sound okay?
Mm-hmm.
Okay, so I'm gonna pull the curtain for you for privacy. So we're just doing a dressing change, to make sure that there's no like drainage on the dressing, as well as like signs of infection, and it just makes sure that like infection control is good and it keeps it clean. So I'm going to take a look here, and we're gonna have to put a mask on in order to provide infection control, because you could breathe into the wound and that could give it an infection. So I'm just gonna put this on your face. I'm gonna have your head tilt this way, away from it as well. Okay. So are you feeling any pain around your central line at all? No? Okay. Do you have any known allergies to chlorhexidine, antiseptics, or tape?
Nope.
No? Okay. And I can see that you have that bracelet on, and that I would scan her in, and my patient is COPD. So I'm just gonna get some clean gloves because we're gonna take that dressing off. And I also I would have done my other 2 med checks within the room and scanned in the meds to verify that I have my saline and my heparin. Okay, so I'm gonna start. I'm gonna make sure not to pull on the central line. I'm gonna take the tape off first. Just throw that away. And then you can see here that the lumens are all locked, which is good. And I'm gonna start by pulling towards my patient, making sure to hold this steady. Feel okay?
Yep.
Sometimes it's a little sticky, so. Okay. Okay, and I'm also gonna take this off. Okay, and I don't see any signs of inflammation. It doesn't feel warm or anything like that. Does it hurt at all?
No.
Okay, so I don't see any signs of infection. Now I'm going to get my sterile field set up. So I'm gonna get my sterile drape out. Okay, and then I'm gonna get everything put into the sterile field, like my 4x4, my new bio patch, my swab, and then at this time I'm also gonna get my saline prepped. So I'm gonna weigh some in order to prime it. Okay. Then we're gonna put the new cap on, the new end on. And I'm gonna save this for later. Okay. So now I'm gonna get my gloves on. Put my right one on first. This glove is a little messed up. It was this glove is not put away correctly, but in the hospital we would not have to reuse them, so this is not taking me as long. Okay, now that I've got my sterile glove on, I have my field sterile too, so I'm gonna start by grabbing my 4x4 and my chlorhexidine, and I'm gonna clean the area around the central line. And I would do this for 30 seconds in order to make sure that it's nice and clean, and I'd also go up the lumen a little bit, making sure not to pull it out. Okay, and we don't fan this to make it dry. We don't want to do that because then it'll just get bacteria in it, which we also don't want. Okay, and now I'm gonna put the bio patch back on.
Got it.
We need a Tegaderm. We're just gonna grab a Tegaderm really quick. And then I would also enter this in to my sterile field. And I would have done that when I had my clean gloves on, but I forgot to grab that. Okay, so now we're gonna put the Tegaderm back on. Okay, and then we peel that off. And then I'm gonna put the label on there because we have to make sure to label them every time we do dressing change. Okay, I'm gonna put that right there. Okay, and then now I'm gonna put tape also around the site, around the lumens, to make sure that they're secure and they also don't get pulled out. Okay, I'm gonna do my measurements to make sure that it has not come out or migrated out of here, and I'm gonna measure all the way from there to the farthest lumen. Okay, it matches what their chart says, and I'm also gonna chart that, and that's just to make sure that the central line isn't coming out any farther than it should or moving. Okay, and I'm gonna do my saline flush. I'm gonna prime the new cap. We are going to remove this one. And then I would attach this, and I would do it normally for a minute. Oh, we had to unclamp it and pull back for blood return. Okay, there is blood return. If there wasn't, we'd make them move their arm. We would also make sure that it's unclamped, and then if it's none of that works, we would tell the provider. Okay, now that I see blood return, I'm going to flush. Okay, now I'm gonna grab my heparin, and I had already primed it, so I can insert this. This is just to make sure that no clotting happens within the central line and to prevent anything from sticking to the lumen. Need my new cap, put that on, and then I'm also going to make sure to clamp it. And then I'm going to write down my initials, the date, and the time. Okay, so how's everything feel so far?
Good.
Okay, so now that we got everything changed, I put that down. You are done, so I can take your mask from you. Okay, and then I'm just going to properly dispose of everything into the trash, and central line is complete.